My name is Ron Falcon. I'm a dermatologist. I have a very busy practice on the South Shore of Long Island, right near the beach. Anyone living on the South Shore of Long Island knows that the sun is a place where we can all have a lot of fun. We have beach, we have boating, we have all sorts of outdoor activities. Unfortunately, the sun is not very good for you. I have many patients who have skin cancer, melanoma being the most dangerous type of skin cancer. Early detection of melanoma will be a cure, and unfortunately late detection of melanoma right now has a very, very slim chance of survival. The traditional methods of evaluating a mole or a nevus on a patient are looking at the A, B, C, Ds, and Es of a lesion, and the gold standard was just biopsying a lesion if it broke any of those rules. I found out about a device that was developed in England about 15 years ago called a siascope. It takes the traditional methods of the two-dimensional visual observation or photography and lets us see much deeper into the dermis so that we know what's going on with the mole. It was, at the time, a very expensive device, but I felt it was worth it for my patients that if I could detect melanoma even earlier or detect that a lesion was not a melanoma, it would save the patient the biopsy, it saves the patient the scarring, and it gives us a reference point to check the lesion at the next visit. Since then, it's truly become an integral part of my practice. The patients, firstly, love the fact that immediately they'll know if it's something that I'm worried about or not. I do explain to them before I do the imaging what we're looking out for. Every patient looks right over at the screen because they know immediately whether indeed it's something that I'm going to have to biopsy or not. Christine is a very common type of patient in my practice, in that she has a family history of melanoma.
My dad, when he was 62, he found that he had a mole on his back and he didn't treat it. He found that it was malignant melanoma, and that's what was the cause of his death.
So, I know you were here a few months ago for us to check your mole, but there was one in particular we wanted to check again. When she first came to our office, she had one lesion on her leg after her father had died of melanoma that she was quite concerned had changed, and we did biopsy that lesion for her, even though the siascope said it was not a cancer, and indeed it was not a cancer. It did give her much more confidence in the siascopic views of these lesions, and for the past 10 years we've been able to follow her without having to remove one mole.
But it was wonderful that you wouldn't have to get a procedure and it could just be done in the office, and right away you know if it's good or bad, and it's a relief.
In Priscilla's case, she's been a patient of mine for many years. The mole that she has on her upper back has worried her internist for more than 20 years. Clinically, it has not changed in those 20 years, and it was not until I did a siascopic evaluation of the lesion did her internist finally believe that indeed it did not have to be removed.
He does not have to do surgery, and I have one less scar on my back. That's very nice.
In Susie's case, she's a relatively new patient of mine, and she'd been told by a number of dermatologists to have moles removed, and she'd be very self-conscious of scars in the areas where those moles are.
The mole on my chest is in a very sensitive area, and of course I don't want to have a scar there, and I would definitely don't want a knife going there.
Thankfully, in doing a siascopic evaluation of them, none of the lesions that she had to be removed.
I was blown away by how accurate, how quick, and how simple it was.
Otherwise, I'll see you in 6 months for a recheck of all of your moles.
Okay, great.
Jessica was sent to us by her pediatrician for evaluation of a mole that her mother and the pediatrician noticed was changing on her face. Jessica, we're going to take a picture of your mole again, just to make sure it hasn't changed since the last time I saw you. Using the siascope to prove that the lesion did not have to be removed saved this young girl the stress of surgery that she was quite nervous about, and the scarring that would be more severe if she had it done now, this early in her life. I found that the MoleMate has truly become an integral part of my practice. Patients no longer have the pain or the waiting period that's associated with the typical biopsy. They get instant gratification in knowing that the lesion does not have to be removed and they don't have to be worried.
It helps me keep up with my checkups because now I'm not afraid that, I'll have to go get needles, or I'll have to get cut up, and it's just so much easier.
It's definitely a patient-centric technology whose time has truly come.
It's concise, it's simple, and it's clean.
I do believe it should become mainstream in all dermatology offices.
And I think it is just a matter of a short time before every dermatologist will integrate this into their practice.